This session we are going to speak about the thoracic bones. You know the anterior bones called the sternum, and you have 12 arc of the bone that called the costa or ribs in each side, left side and right side, and posteriorly. Also we can introduce to you some of the vertebrae that belong to the thorax cavity and called the thoracic vertebra. They are 12, T1 to T12. Please look at to the sternum. Sternum consists of 3 parts. The superior part is very flat and large and called the manubrium. The middle part is the longest part and called the body, and inferior part called the xiphoid process. About the manubrium, as you know, the manubrium is going to make a joint to articulate with the superior part of the body and make the sternal angle. The sternal angle is a kind of cartilaginous joint. It is a kind of symphysis. A sternal angle is a good landmark in clinic. If you find the sternal angle that convex anteriorly in surface anatomy, if you find the sternal angle and you go laterally, you can find the second costal cartilage. The second costal cartilage, when you find, then you can count and find the other ribs. About the manubrium, the superior border here is a landmark in surface anatomy. Here you can find a notch that called the suprasternal notch or jugular notch. And in each side of the jugular notch, you are able to find the articular facet. This articular facet belongs to the medial or external end of the clavicle. This joint called the sternoclavicular joint, and it is a kind of synovial joint. It is a kind of saddle joint. In each lateral border of the manubrium superiorly, you can find the articular facet in each side. This articular facet are going to articulate with the first costal cartilage. It is not a synovial joint, it is a fibrocartilaginous joint. And also, if you come down, inferior part of the manubrium in lateral border, you can find the demifacet. This demifacet from the manubrium and demifacet from the body of the sternum. Both of them make a complete articular facet for the second costal cartilage. The costosternal joint, all of them are synovial joint, except the first one. The first one is a fibrocartilaginous joint. About the body, you can find in each side, after the demifacet, you can find completely facet. They are responsible to articulate with the other costal cartilage. Here, for the 7 costal cartilage, you have find variation. Sometimes, such as this moulage, you can find that the 7 costal cartilage is going to articulate with the xiphoid process and the body. And sometimes it is possible the 7 costal cartilage only articulate with the body of the sternum. About the rib, please look at the rib. The first rib is have a very curve, and the 7 first rib called the 2 ribs because all of them are going to articulate directly with the sternum. About the 10th costal cartilage go up, articulate with the 9 costal cartilage. The 9 costal cartilage go up, articulate with the 8 costal cartilage, and the 8 costal cartilage go up and articulate with the 7 costal cartilage. So about the 10, 9, and 8 rib, these are the false rib. And about the 11 and 12 ribs, we call the floating rib or free rib, because the anterior end of the rib that you can find the costal cartilage, they are not going to articulate with the sternum. This part of the cartilage that join to each other called the costal margin. It is a landmark in surface anatomy in the clinic. The costal margin in the body of your patient is you can find and you can palpate this part. About the rib, you can find the anterior end, and each rib posteriorly is going to articulate with the lateral border of the thoracic vertebra. About the vertebral column, you know the superior part of the vertebral column belongs to the cervical region. Here we have 7 cervical vertebrae, C1 to C7. And in the thoracic region, we have 12 vertebrae. We call thoracic vertebra, T1 to T12. Inferior to thoracic vertebra, you can find lumbar vertebra. In the lumbar vertebra, you can find 5 lumbar vertebra. And inferior to the lumbar region, you can find the sacrum. Inferior to the sacrum, you can find the coccyx.